Good morning, everyone. An advisory from the Massachusetts Department of Public Health has been issued for all non-vaccinated and fully vaccinated people to wear a mask in public indoor settings in areas of substantial or high transmission. Shrewsbury, Worcester County has been categorized as a high level of community transmission for over a month. Therefore, we require that all employees and visitors in all municipal buildings wear a face mask. Exemptions from the mask requirement include those with a medical or other eligible condition. In addition, we ask all those attending the meeting to practice social distancing, leaving space between yourself and other non-related parties also attending the meeting. The board members here this morning will also be masked and practicing social distancing through their seating arrangements. When speaking, we do ask that your face masks remain on. Thank you. Okay, this meeting of the Board of Health is being held on Friday, December 17th, 2021 at 8 a.m. in the Selectmen's Meeting Room at the Richard D. Carney Municipal Office Building located at 100 Maple Avenue, Shrewsbury, Massachusetts, 01545, at which time and place the Board of Health will consider the following agenda. So I'd like to call the meeting to order. And the first item on the agenda is the review and approval of minutes from the November 19th, 2021 Board of Health meeting. Do I have a motion to approve?
So moved.
I'll second.
Okay, thank you. All in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. So the meeting minutes are approved. I think what I'll do now is skip to the review and act on the report from the Central Massachusetts Regional Public Health Alliance. And Micah, do you have a report to give?
Sure. It's been fairly normal. Masking kind of improved after the mandate was put into effect, and now with all the holiday shopping, it's been kind of back to a struggle again. So it's constant following up on complaints for masks, and it's going to be beneficial as more towns put in mandates or the state gives more direction. I think it's going to be very beneficial. But beyond that, that's all I have to report.
Okay, and I guess the Yuletide market went well?
Yes, it did. It did. It was quite a big group of people there, but yeah, it went pretty well.
Yeah, I saw all the food trucks, so
Yeah.
it was very busy. Okay, any questions from the board of Micah?
Nope, not this time.
Okay, I guess we still don't have Karen Clark yet, right, Carrie?
She won't be able to, she said, just if Dr. Abraham could please
Okay,
provide an update. She's sorry she's not able to. Oh, and she said, can you, we administered almost 1,000 doses through public schools and almost 200 doses of the vaccine at St. John's High School.
okay. So our next item on the agenda is review and discuss coronavirus COVID-19 update. So I guess a lot's been happening lately, Dr. Abraham.
Yes, so statewide, we've sort of doubled our prevalence rate. So recall we were around 2.2 to 2.5% a month ago when we met here, and now we're at 5.5%. And nationally as well, we have Omicron in the state, and the roughly doubling rate of that is every 2 days it doubles. So it seems to be more aggressively infectious than the current Delta variant, which is the common one. And so it's expected to become the most dominant strain, especially in January and February, by which time it'll have taken significant hold over the Commonwealth. We expect January and February to be problematic months for a couple of different reasons. Number one, the surge with both Omicron and Delta, and we're seeing flu activity. So if you look at our flu surveillance across the state, there's been a surge in flu cases similar to what we saw in 2019, so pre-COVID. And so there's some concerns about capacity given the combination of flu and COVID-19 sort of coming to a head together in January. So the continued urgency is everyone should get boosted. So there's clearly data to support that people who are boosted get about a 25 times increase in antibody effectiveness compared to people who have not received the third dose of the vaccine. And that is our best bet. So if we look at, there's been published data now on the effectiveness of vaccines. Moderna and Pfizer sort of go head-to-head in terms of its efficacy against Omicron, followed by a significant fall-off for all the other vaccines. And you may have followed yesterday, the CDC issued guidance saying that if they had received a J&J vaccine, then the booster should be an mRNA vaccine, so either Moderna or Pfizer, as opposed to J&J, for two reasons. One, the mRNA boosting following a whole viral vector vaccine, which is what J&J is, seems to show better efficacy, and most of the world had done that way before we approved that here in the US. And number two, there has been a small number of people who've had an increased evidence of increased number of events where clotting is an issue. So people have thrombotic events, which is still relatively mild or minor compared to the overall number of vaccines provided, but there is a significant increase compared to people who get the mRNA vaccines. And so therefore, a recommendation. So the CDC has come out with that, which is unusual. The ACIP, the Advisory Committee on Immunization Practices, which is the advisory body to the CDC, made that recommendation. CDC quickly followed suit to endorse that. So essentially at this point in time, the scientific community argues that 3 doses of vaccination is really considered fully vaccinated, and so 2 doses are no longer considered fully vaccinated. Our hospitals are seeing essentially still about 60-70% of cases of people who are unvaccinated who are in hospital, unfortunately. And the other 30 to 40% are people who've had 2 doses, not gotten their third doses yet. We have no hospitalizations as yet of anyone who's received all 3 doses of vaccine, which is encouraging for a number of different reasons. One, clearly showing that the third dose does augment the immune response, so people do get protection. And number 2, that it's probably also effective against Omicron to a significant enough extent. And then finally, as we gather over the holidays, the CDC has recommended that if people are coming from different areas of the country or different families are getting together, then everybody get a rapid test to sort of make sure that everyone is negative before they gather together, especially because we're going to be indoors, we're going to be unmasked, and people are going to be eating and drinking, so there's risk for potential exposures. So as we stand in the county, we are still red. If you've looked at the Massachusetts map, there's virtually almost 95-98% of the counties in the state are all in the red, meaning there's active transmission to a significant extent. So I think our masking continues to be an important measure, as well as obviously distancing and taking precautions to be sure that we don't transmit.
Okay, thank you very much. Thank you very much. Any questions?
Well, I heard Worcester is starting to hand out rapid tests.
Yes,
Okay.
so great point, thank you. Yes, so there's a national initiative to do that, and Worcester, so I think there are grants from the federal government, and so the governor has also been pushing to hand out rapid tests exactly for that reason, especially in people who otherwise might be reluctant to test. There are pros and cons of doing rapid testing at home. The advantage, obviously, is people can screen more effectively and not have to wait in a queue, which is a disincentive at a time when they're busy with other commitments that they might not do that. And so, therefore, we increase testing so people are more aware of what their status is. The downside, obviously, is that if they do test positive, they should still report to a local authority, just because we need to track the trends. What happens when you test at home is that information doesn't go anywhere, unlike when you test at a facility or in a hospital, et cetera. And so recommendation is that if you do, still notify, not so much for any other reason other than for tracking. So if there are trends or clusters or something like that, then at least public health measures can be reinstituted. Great question.
Are these tests, fairly accurate?
Yeah, excellent question. So the tests are the same as what they've been before, but we do understand clearly that as the prevalence, so as the number of cases across the community rise, the accuracy of the test goes up, in the sense that a negative test is more likely to be negative and a positive test is more likely to be positive. So the positive predictive value of the test, as we call it, and Jenny's the expert in epidemiology and statistics. So in statistics, we say the positive predictive value goes up as the prevalence of the disease goes up. So we believe the tests perform better given there's more widespread disease. So that's why the rapid tests are as good as getting a PCR, or maybe almost as good as a PCR in this setting right now.
Okay, great. Thank you very much.
Great.
Any other questions?
I did have a question around guidance for kids and sports. I did have a parent come to me with some concerns about guidance from the rec department, that it wasn't very clear if the child had exposure, waited the 3 to 5 days, tested negative, then could they participate in a sport that weekend? They were told they were not. And I think the guidance is not very clear.
Right, and that may be something for us to maybe recommend to the town to maybe address, but I think Jenny's point is well taken, that technically if they test negative by day 5, which would be, they are considered non-infectious at that point in time, so they should have been allowed to participate, so I think her point is absolutely well taken.
Yeah, I don't know if that's something to take up with the manager's office to provide guidance, or,
Well, all those
Or the school department.
complaints come through our office, and they're put into the WDPH log, and then a public health nurse is assigned and follows up directly with the person.
okay, great.
Okay,
Yes.
great.
Thank you very much.
Thank you. Okay, anything else, Jenny, or, okay? I guess I'm all set. Okay, our next item is to review our meeting schedule. So we'll be looking at January
14th
January 14.
or 21, either one is.
Either one is okay.
Yeah, I think that looks fine. Will we be in person, or should we do it remotely for January? I don't know.
Good question.
I'll be getting guidance from the town manager's office.
Okay,
Yeah, and I will absolutely let you know.
Okay.
thank you, Carrie.
Of course.
So, so are we talking about the 14th then?
Yeah, that,
Is that okay?
that works, yep.
Sure.
Okay. So we'll make the next meeting of the Board of Health for January 14th at 8 a.m. Okay, unless there's anything else, do I have a motion to adjourn?
Move, so moved.
I'll second.
All in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. So this meeting is now adjourned. Thank you, everyone.
Thank you.
Thank you.
Merry Christmas, Happy Holidays.
Yes.
Yes, all of
exactly.
you as
too.
well.